Chapter 10, Opiates. This is the full video of my lecture for the Substance Use Disorder Counseling and Chemical Dependency classes. In this video, we will examine the origin of opium, some of its history, the wide variety of opiates currently available, and the problem of addiction to those opiates. This is the chapter and video on opiates by David Joel Miller. Some of this material originally appeared on my blog, counselorsoapbox.com. The photos are courtesy of pixabay.com and Wikimedia Commons. Opium poppies were originally found growing wild in the Turkey and Iran area of the Middle East, mainly in the higher mountainous regions. Early opium use. Poppy seed pods scored with a knife. A white milky sap contains opium. The use is a very ancient practice. Raw opium can be chewed or smoked, dissolved, and swallowed. Opium was used by the Greeks, who chewed the gum from the poppy plant. If you think about the wars, Hercules and those characters, many of them chewed the opium gum, and as a result, it both helped reduce the pain if they were hit and hurt by a sword, and also reduce the bleeding. The primary uses of opium are as an analgesic for pain relief, as a cough suppressant, as an anti-diarrheal, and the use is widespread in the Middle East because the Quran prohibited alcohol. By 800 AD, Arab traders had spread the use to India and China, and because of the long trip there, the opium gum got hard, and when it reached China, it was commonly smoked rather than chewed. The Opium Wars. In 1729, China bans the importation of opium. Despite the ban, demand remained very high. The British ships, and at that point India was a British territory, traded opium grown in India for tea and then returned that to England. It was a very profitable business. China's effort to prevent the importation of opium resulted in the Opium Wars, two of them, between England and China. If you've paid attention to recent news, you know that one of the consequences of England winning the Opium Wars was that they were granted a 99-year lease on Hong Kong and some other places in coastal China. That 99-year lease recently ran out, and control of Hong Kong has now returned to China. Morphine was separated from opium. German chemists separated morphine from opium about 1803. Once that separation is completed, there's a residue, and that residue contained codeine, which turns out to be 10 times as strong as the original opium. Morphine use during the U.S. Civil War. During the Civil War, more soldiers died of disease in camp than in battle. Some units, 10 men died in camp of disease, mainly diarrhea, then died from gunshot wounds. Chewing opium gum or drinking morphine sulfate dissolved in alcohol reduced the diarrhea and was used to treat those illnesses. Morphine addiction was so common among returning veterans, probably more on the Northern Union side than on the Southern side, that morphine addiction came to be called the soldier's disease. In the period after the U.S. Civil War, laudanum became an important beverage. Morphine sulfate, was used as a powder, which could be dissolved into alcohol, often whiskey, to make a drink called laudanum. Drug use grows with the United States. In the U.S., drug use, after the U.S. Civil War, alcohol was part of the westward expansion. Morphine sulfate and laudanum were used during the Civil War, and after the Civil War, morphine was added to a great many products. In California during the gold rush, frequently the first business to open was they would set up a tent, 2 barrels, and a board that ran between them, and the saloon was open for business. While we think of those Old West saloons as serving whiskey, often that whiskey contained morphine and was laudanum. In the period of westward expansion, increasingly patent medicines became popular. Most of those contained both alcohol and morphine in the form of laudanum or a milder form, paregoric. Also, soothing syrups, which were given to babies, were very common. If you remember Grandma having the home remedy of rubbing whiskey on the gums of a baby who was teething, think about great-great-grandma who probably was rubbing whiskey, which contained morphine in it, on the gums of a baby. Give a baby a little bit of morphine and alcohol, and they probably will sleep through the night. Heroin is another opiate, and in 1898, heroin was introduced as a wonder drug by the inventor of aspirin. It was initially introduced as a cure for morphine addiction. Turns out that if you give a morphine addict some heroin, within a few days they don't want morphine anymore. What they want is more heroin. The Harrison Narcotic Tax Act of 1914 required a prescription for opiates and banned heroin, because the thinking at the time was that heroin was much more addicting than morphine. Opiates began to be supplied by organized crime in the period 1914. We're in the period running up to World War I. In the period after World War I, organized crime moved into it, and opiates, heroin in particular, were mostly found in the poor inner city areas. As a result of an increase in demand for heroin and other opiates, poppy cultivation spread. While originally it was mostly in Turkey and northern Iraq, it has moved into Iran and more recently into Afghanistan and down into Burma, the Golden Triangle. Heroin poppy, the poppies, opiate poppies, are now grown in Mexico and in some places in South America. Purity of what's available on the street fluctuates widely. When large quantities are coming in from Afghanistan and that area, it can drop dramatically and the purity can be much stronger. When prices rise, the tendency is to add other ingredients to cut or step on the product, and the resulting product can be significantly milder, less heroin or opium in it. Heroin addiction is really hard to shake. We think of heroin as a U.S. problem, but in several countries in the Middle East, they have an extreme opiate addiction. In Arab countries where alcohol is forbidden, still they have a large problem with heroin addiction. One study conducted in this area tracked people who had gone into treatment for heroin addiction. Over a 33-year period afterwards, 50% of heroin addicts died. This is 50 to 100 times the rate in the general population. 20% of those who had been through treatment were still using, by their own report. 10% refused to test. 14% were in prison. Total, 94% did not get clean. Over a 33-year period, only 6% ever got clean. There are many death and disease risks of heroin and other opiates. An overdose, higher risk if it is combined with alcohol or any other depressant drug. Potency can vary widely. One result of that is someone who is arrested for heroin possession goes into the jail, detoxes there, gets out after, say, a month, goes home and discovers a baggie of heroin that was exactly what they were using every day before they went into the jail. They used that. As a result of declining tolerance over the month of not using, the dosage in that could be a fatal dose. Some other issues are HIV or AIDS, IV drug users, principally heroin, but more recently meth users, have much higher rates of HIV or AIDS. Hepatitis C is also extremely common, and injections from contaminated needles can spread both of these viral infections and a great many other illnesses. Recently, we've seen a lot of designer heroin, which is manufactured in clandestine labs and can be almost anything. The picture on the right illustrates the idea of an overdose death, though the pills involved there are probably not an opiate. Prescription opiates are becoming the problem in America these days. Currently, far more people are dying from prescription opiates than from heroin. It's important to draw a distinction. The picture on the right is a prescription package from a pharmaceutical manufacturer, but prescription-grade opiates frequently come from illegal labs and are not part of the supply chain from the pharmaceutical manufacturers to the pharmacy. Prescription opiate use surpasses heroin use. The OD rate is higher than for heroin. There's more prescription abuse among teens. There are many prescription opiates: hydrocodone, brand name Vicodin, oxycodone, known as OxyContin, morphine, Dilaudid, methadone, Demerol, fentanyl, and recently we've seen a lot of carfentanil, which can be up to 100 times the strength of fentanyl. There have been cases where first responders received an overdose death simply by handling baggies or needles that had contained the carfentanil. There are other sorts of opiates, opiate agonists, partial agonists. Bupropion or Suboxone is in that family, designed to be used to prevent people from using them stronger, more addicting opiates. Also, there are two semi-synthetic, tramadol and Ultram, that are sometimes classified as opiates, but other authorities say that they are not technically an opiate. They're both pain relievers and slot into similar receptors to what the opiates do. Medical opiates and derivatives. There are many opiates that are supposed to be used in a hospital setting. Fentanyl may be 10 to 1,000 times as potent as heroin. I just mentioned carfentanil, even more potent than fentanyl. One of the synthetics, MPPP, is a designer opiate, but turned out that a chemist who was making this illegally made a mistake and produced MPTP, which destroys the substantia nigra and causes sudden onset Parkinson's. Prescription opiate abuse has become very common in America. Pharmacokinetics of opiates. Opiates are readily absorbed in the gastrointestinal tract. This is one reason so many people take prescription opiates orally. There is a greater effect if it is injected IV. Opiates can be smoked. Heroin can be smoked, although a lot of the potency is lost, and powdered opiates can be snorted. Opiate distribution, metabolism, and elimination. Opiates are distributed throughout the body, tend to accumulate in the kidneys, lungs, liver, spleen, gastrointestinal tract, muscles, and the brain. It's largely metabolized in the liver. They are excreted in the kidneys. 90% are excreted in one day. Traces can remain for 2 to 4 days. Heroin more readily penetrates the blood-brain barrier, and opiates work on the endorphin system. Endorphin meaning endogenous morphine. The medical uses of opiate drugs. The major medical uses for pain relief. Now, think about this. If when you are taking opiates, or a user is taking it, they don't feel pain, one of the withdrawal effects When they stop taking the opiate will be an extreme sensitivity to pain. They will feel every little touch. Medical uses also include coughs of codeine or a similar compound, dextromethorphan. Opiates are used to treat diarrhea, especially in babies or the very young. Again, the corollary, if it's used to treat diarrhea, users, heroin users in particular, experience extreme constipation and may have to take laxatives every single day in order to pass bowel movements. Some opiate type drugs can be used for treating addiction. Methadone, which is a very powerful, potent opiate drug, is often given to heroin addicts. The problem here is that once the addict is on methadone, they will probably be on it for the rest of their lives. Methadone detox withdrawal is much worse than heroin withdrawal. There are partial agonists who are not quite as effective on pain, but are not quite as addicting also. And one of the goals of pharmaceutical companies has been to produce a pain reliever that was not addicting in the way opiates are, but was as effective. To this date, nothing has been found that is more effective at treating pain than the opiate drugs. The acute psychological or physiological effects. Vivid dreams, called pipe dreams, that's smoking opium in a pipe is the origin of the expression pipe dreams. Opiates interfere with cognitive function, impair learning and memory, may cause respiratory depression in combination with alcohol or other central nervous system depressants. This can be fatal. Opiates lower the body temperature. They cause nausea and vomiting. Most people who take prescription opiates have to take an anti-nausea pill with it. An acute effect is extreme constipation, which requires daily doses of laxative. OD deaths often have less opiate in the bloodstream than would be expected. And this is because of the synergistic combinations of opiates with alcohol, sleeping pills, tranquilizers, and other central nervous system depressants. So there are lethal interactions whenever opiates are taken in combination with alcohol or any other depressant drug. Chronic opiate effects. Tolerance builds and users have to increase the dose to get the same effect. There is severe withdrawal symptoms. When we say withdrawal, most people think immediately of the kicking that heroin addicts or other opiate addicts go through. Often those withdrawal effects occur 8 to 12 hours after the last dose. They would include flu-like symptoms, a runny nose, tearing, sweating, irritability, and tremors. As time passes, symptoms become more severe, plus some new symptoms: pupil dilation, anorexia, and goosebumps. Symptoms peak at 48 to 72 hours. This is one reason 72-hour detox episodes have been so terribly inefficient, because we're releasing people from detox at the point where the withdrawal symptoms are their absolute worst, 72 hours. The peak symptoms include heart rate and blood pressure that are elevated, bones aching, spasms of arms and legs, hence the term kicking. There can be a significant loss of fluids, not eating or drinking, which can be fatal. 90% of the people who detoxify will relapse, often within the first week after kicking. Some terminology that we used in this video, in this chapter, that you should be aware of. Opium, that's the grandfather of all the other opiates. Analgesic, pain reliever. Didn't mention it in this, but naloxone is a antagonist which can be given to neutralize the effects of heroin. This year, the government began requiring that chronic pain doctors who prescribe opiates also prescribe naloxone. One of the challenges with using naloxone, and it's currently available as a nasal spray, so any family member could administer it, is that while it will immediately reverse the effects of the opiate, the naloxone will wear off, and then the person will go into fatal withdrawal again. So if someone administers naloxone, that person, the person who has the overdose, should go to the hospital immediately. And in addition to analgesia, which is reducing pain, analgesic is another term that you should be aware of. What are some of the things you should have learned from this video? Opium poppies were originally found growing wild in the mountains of Turkey. Opium gum has been used since ancient times. There are three primary uses of opium or other opiates: pain relief, cough suppressant, and anti-diarrheal. Opium wars were between England and China. We should always note that drug-related political events continue to be a part of our life today. Morphine use was spread by the U.S. Civil War. You should know what laudanum is, and also students should be aware that including morphine in other patent medicines, such as soothing syrups for babies, resulted in widespread opiate addiction prior to the Harrison Narcotic Tax Act. And last, you should know that withdrawal from opiates is at its worst at 72 hours after last use.